Hello, happy Friday. I am very excited to be here. My name is Rachel D'Souza. I am the founder of Gladiator Consulting, and you are here for Friday Lives with Gladiator. Today is a very special and meaningful day for me. You can see that I'm in my red because we are in February, which is Black History Month, and it is also American Heart Month. And today, Friday, February 6th, is Go Red for Women Day. It just so happens that heart disease, cardiovascular disease, is the number one killer of women in the United States. And Go Red for Women is a program of the American Heart Association that helps raise awareness and resources to help women live longer, healthier lives free of cardiovascular disease. This year, I have been invited by the American Heart Association of Metro St. Louis to be a Woman of Impact nominee. So I also get to share with you today that I am kicking off a campaign for advocacy and awareness raising specific to helping women understand their risks for cardiovascular disease and things that they can do in their lives and with their communities, again, to make sure that they're living longer and healthier lives. This is, not to be too coy, a cause that is actually quite close to me, to my heart. About almost 15 years ago, back in 2011, I was pregnant with my first child. And 8 days after he was born, I suffered and survived a spontaneous coronary artery dissection, which caused actually a massive heart attack. I was in the ICU for 3 days and had lots of people trying to figure out why a woman at the age of 28 with no risk factors other than having been pregnant would have suffered a heart attack. And so over the last 15 or so years, I have had to learn what it means to live a heart healthy lifestyle, have to figure out how to, filter exercise into my life, how to make sure that I'm, eating healthy and that my family is eating healthy, that I'm taking the medication that I'm supposed to take. And then, in the midst of being a working parent, also not be, stressed out, try to keep my stress low. It's difficult. And, being a survivor of heart disease for me has really meant that I've had to build community. I've had to rely on people in my life to both keep me healthy and to help me figure out how to build a life for my children that is also healthy. I think that women, especially working parents, we often put everything else before our own health and well-being. And that doesn't make it any easier for us, to maintain our heart health. So I'm really excited for the guest that I have here today. Over the course of the last year that we've been doing our Friday Lives, we've had the opportunity to bring in lots of different practitioners and experts across the sector. But I get to introduce you to one of the most important people in my life, and that is my son, Cameron. So, Cameron, I would love for you to join me.
Hi everyone. Cameron. It's nice to see you guys today.
Awesome. I'm glad you're here. Yeah. So, what has it been like for you to kind of grow up with someone who's been very public about a personal health struggle?
I gotta say, I feel like a lot more knowledgeable and involved than I think the regular person. Like, as you can see right now, I'm wearing red for Wear Red Day, like I have been for the past 14 years.
Mhm.
So that's been. And then I've gone to a bunch of events with my mom about heart health, and she's talked to me about it. So I feel like I understand a lot better, and I feel like I understand the risks of putting of like the risks of not taking care of your health and how heart health affects people and how like heart disease is the number one killer in America. So
Yeah, no, I'm glad that you've been listening to me. Because we're going to have some vegetables, right? When we have our Super Bowl party on Sunday, we're not just going to make all kinds of unhealthy food, right?
Of course, yeah, of course.
We'll have carrots for our buffalo chicken dip. Yeah, I mean, I think that's really true. You were, on stage with me at the American Heart Association's Heart Ball, when you were 11 months old. You've been in different kinds of videos with me. Because you were, a baby when all of this happened. Do you even remember the first time you like heard or understood what it meant to have a mom that had a heart attack?
I just remember like knowing it. So
Okay,
I
good.
think
It was never.
first time was before I could like remember it.
Yeah, I will say that since you were very little, one of my best friends from high school, Colleen, gave
Oh,
us this little stuffed anatomical heart, and so you actually had this little guy in your room.
I
Gosh,
remember
for a very long time.
for a
So
long time.
yeah,
Yeah.
I believe that. Yeah, my story has sort of always been a part of your life.
Oh,
So when kind of think about knowing what it takes to be healthy, or you observe the things that other people are doing. Like, how do you think telling a story or sharing why you care, like, what do you want to see people learn from this or learn from knowing that heart disease is the number one killer?
well, I think it's really important that people understand that you have to take care of yourself.
Hmm.
Like I can't say that I'm vegetables' biggest fan, but you have to eat healthy or else your heart's gonna get bad. If
Yeah.
you only eat junk food, you don't take care of yourself, you have a heart attack. And it's also important to stay active. If you're
Hmm.
not active, then fat builds up and it can clog your heart and you can have a heart attack. So I think it's important for people to know that they should take care of their bodies by eating healthy and staying active.
Yeah. And how do you do that now? What are the ways that you eat healthy or that you exercise or keep your body healthy?
Well, I cook with mom and dad all the time, and we always make sure to pick out some recipes that are healthy. And if they're unhealthy, we always make sure to make some vegetables and fruit on the side to keep a balanced diet.
Hmm.
And I stay healthy by running track and cross country at slow high.
Hmm.
And I work out sometimes with weights in the slow weight room or on the Peloton we have here.
Awesome. Do people ever like make fun of you for doing healthy things, or are they curious about how you build those healthy habits?
People are more often curious, actually. I don't think I've ever been made fun of, which I think is a good thing. I think a lot of people are working to get healthier, and they ask me how I stay healthy.
Yeah.
So,
Yeah.
yeah,
Yeah. So it's not just necessarily a decision that you make, but it's also something that you can encourage your friends and your family members and neighbors and stuff to be a part of as well, because you have community that will support you in your healthy decisions.
absolutely, yeah.
Awesome. So you know that your mom has a very, I guess, public life. I spend a lot of time trying to, tell stories of folks that don't always get heard, to raise up causes that aren't always supported. You're on the other side of that though, because when I'm out here, you're at home. What do you think that people might misunderstand about what it means to be committed to advocacy or committed to telling your story or committed to doing healthy things?
I think some people think that people only tell their stories because it happened to them and that they want people to know about it. But I think when you go out there, you're trying to tell people so you can warn them and prevent it from happening to them too. So
Yeah.
you're out there, you're sharing your story because it happened, and you're trying as a warning so it doesn't happen to other people too.
Yeah, no, I appreciate that. You're very Gen Z, and I feel like you're coming up in the influencer culture, right? Where people are out there putting things on a platform that, might make them some money or might raise their profile. And that's great and that's true. But, you know, how do we use what we know or what we've experienced to, as you've said, sort of have an impact? And I'm glad that you noticed that because that is something that I try to do. Like, having a heart attack, you know, 8 days after your first baby is born, and having, you know, a doctor tell you maybe don't have any more babies, or here's all the medicine you're going to take, like that's traumatic. And I'm not out here, you know, talking about my trauma every day because it feels good to me. But I think I decided a long time ago that maybe if I tell my story, maybe if I talk about, you know, what happened, maybe if I, you know, explain the mistakes that I made, that someone else will hear that and they won't go through what I went through. I mean, I remember the morning that I had my heart attack, you know, your dad wanted to go to the gym. And I was like, okay, you can go to the gym, but, you know, before I sit with the baby, I want to go brush my teeth. And so I went to the bathroom and I brushed my teeth. And that's actually when my heart attack started. And I remember coming out of the bathroom into the living room, and you and your dad were sort of outside in the backyard, and you were really little, and I mean you were 8 days old, and I think he wanted, you know, to take you outside and let you have some fresh air and things like that. And I remember going to the back door and saying, hey, I need you to come in, like I don't feel good, something's wrong. And, you know, most people at that point should have called 911. I think that was probably one of the biggest mistakes that I made that day, is that I called the doctor, and the doctor said, well, you can, you know, lay down, or you can, you know, drive out here to my office or whatever. But I wound up, you know, your dad drove us to the emergency room, and we left so quickly that we didn't even bring the diaper bag, so we just brought you. And I don't even think I had changed my shoes. I think I was still wearing my house slippers. And so when we got to the hospital, we were like, hey, do you have some diapers, do you have some formula? Like, we came here with this baby, and we've only been parents for 8 days, and we forgot, you know, all his stuff. And you wound up staying with your grandma while I was in the ICU, you know, getting everything together. But you did get to come visit me. I will have to find the picture of that. Your Aunt Becky dressed you up actually in football attire. You had little football socks on. I remember that. I remember being sad that I hadn't gotten to put you in that outfit. But when I finally did get home from the hospital, I got to give you a bath in the kitchen sink because you were still so tiny. And I felt so, so, so lucky that I had been able to do that. And that I got to spend that whole evening with you, and that I get to be your mom. So yeah, like I just, getting a chance to watch you grow up, makes me feel very lucky. And I know a lot of women, you know, haven't had that opportunity. I think one of the things that has been true is, you know, since you were a baby, I have had to ask for help. You know, grandmas and grandpas have come to spend time with us. We've had aunts and uncles that have gone for walks or taken us to doctor's appointment. How have you seen other people in our family sort of get into a heart healthy mindset or support these ideas and advocacy?
So earlier I said that I like to cook with mom and dad.
Mhm.
And a few months ago, actually, my mom showed me a cookbook made by my uncle Doug, which he gave to her after her heart attack. And it is filled with a bunch of heart healthy recipes that she could have made after her heart attack. So I've seen a lot of support through my family from my mom. They come to her events with her, they wear red on Wear Red Day, they make cookbooks for her with heart healthy recipes. I think everyone's been very supportive, and they do a great job of it too.
Awesome. And what about your little sister? Has she done anything
I
special?
think Amelia actually might have done the best out of all of us so far. I think she's very good. So every year at my old school, City Garden Montessori, they host a competition in the month of February to see which student can raise the most amount of money for the American Heart Association during the month of February. And I think for the past 4 years, Amelia has won it, and not by little amounts either. She's won it by hundreds and thousands of dollars, and she's already on track to win it again this year, going for the five in a row. That
Yeah.
She's done an amazing job of being supportive of mom and raising money for the American Heart Association.
Yeah, it's been really sweet to see the way Amelia has, put in her little fundraiser description. My mom had a heart attack, but then she decided to have me anyway, which is a whole other story. But her fundraising efforts, remember, were recognized by the city of St. Louis at the Board of Aldermen meeting. Was it last year or 2 years ago that they did that? And we all got to go to City Hall and be part of their meetings. So, yeah, I mean, it's my hope that all of these things that we do both make you feel good about your own health, but also, like I said, give you an opportunity to build a community of people that are, taking care of each other and helping each other be healthy. So I have one more, well, maybe I have two more questions for you. So when you think about what you want people to know, or anyone that's watching this, if there's one thing that they leave knowing, what do you think that thing should be?
I think they should know that they have to take care of their health, and I think that they should know that they should share that with everyone else too. That they should be like you and go out there, make sure people know, make sure heart problems don't happen to anyone else, and be an activist just like you.
Awesome. Thank you. Do you have any questions for me? You don't have to, but you're welcome to ask me anything.
I don't really have any questions.
No.
Sorry.
Good. All right. All good. Well, thank you, Cameron, for being our special guest today. Just for the record, he did not miss school. He was off today,
Oh yeah.
and offered to volunteer his time to chat with me. So we are going to wrap up, but just wanted to give you a heads up that our next Friday Live will be on February 20th. And I am very, very, very excited for my colleague here at Gladiator, Amy Bossy, to join me, along with Betsy Cohen, who is a professional in the philanthropic futurism movement, to talk to us a little bit about the state of fundraising and philanthropy in this, new and uncertain time. So thank you for joining us today. I hope that you were read. And if you didn't, it's only the afternoon. There's still time for you to throw on your red hat or your jacket, whatever, and share your picture with us. But I hope that you are able to engage in things this month to learn more about your heart health, and ways to keep you and your community healthy and safe. Thanks so much. Happy Friday.